I was going to ask what your personal experience was with the travel to Ecuador, kind of what you learned and what you learned about the culture. And I think you make an interesting point about maneuvering around the health practices and the cultural practices of indigenous populations. And especially when you go to a foreign country and you're pulling out things that I'm sure that they've never seen before. So that must be interesting for them and interesting for you as well.
Yeah, so it was definitely a very eye-opening experience. So I went, I guess I would have been 20 years old when I went on my first service learning trip with MedLife, which is what kind of these volunteer trips are called. So I went to Ecuador my first year, and it was the first time I really traveled. I hadn't been outside of Canada except down to the States for a couple volleyball tournaments or to Cuba with my family for a vacation. So it was really my first experience traveling on my own and traveling with like-minded volunteers who all wanted to have that positive impact kind of on communities outside of our own. And the first thing I remember thinking was how naive I was up until that point. And I remember thinking, yeah, I'm 20 and I've been in university for 2 years, and I moved across Canada when I was 18, and I know what I'm doing. This will be fine. This will be a great experience. And just even traveling to our first hostel and kind of waiting at the airport to catch a shuttle with MedLife staff. So this wasn't even alone. It was, we walked into the airport and we were directed to where we were going. It was not independent at all. It was extremely facilitated and organized. And I was still, even something as simple or not, if it's disrespectful to tip a server, or if it's disrespectful not to tip a server, whatever it is. So I found that really, really challenging to see, and try and understand and kind of navigate my way around. And I found that the biggest kind of experience that changed my view on medicine and healthcare in general was traveling out to communities outside of the city center. So I went to a rural area of Ecuador, a relatively large city, but again, not quite as developed as what I was used to. And we stayed in a hostel there. It was exactly what you picture it to be. It's a South American hostel. There was lots of great food and friendly people, and just a different environment than I was used to, not speaking the language and not knowing the other volunteers. We all slept in bunk beds in a hostel with 30 people in one room, whatever it was. And I found that at first I thought, yeah, this is exactly what I pictured. This is what I thought all of South America would be like. This is what I watched YouTube videos on and I was prepared for. And then that first clinic day, we drove out of the city for about 3 hours. We hopped on a bus and went out to a mobile clinic, which is where MedLife sets up tents and brings physicians and pharmacists and dentists in to see the local community. And it was out in the Andes Mountains, and it was freezing cold. And there were individuals wearing traditional cultural dress, and no one even spoke Spanish. So my limited 2 sentences I knew wasn't even within the realm of understanding, because they all spoke a separate dialect that I wasn't familiar with, and very few of the volunteers were familiar with, even those who spoke fluent Spanish, because the dialect was just that different. And it was just completely eye-opening, and to see the different ways people live and understand that healthcare, to me, I think about it, yeah, oh, maybe I sprained my ankle, I need to go into the doctor and get an x-ray. In Canada, it's extremely easy just to pop into a walk-in clinic, get a referral, go get an x-ray. It's not going to impact the money I have for rent. It's not going to impact my parents' salaries. It's not going to change anything. It's pretty much covered. And it may take a little while, but it's not the end of the world. If I have a minor ailment, I can get it dealt with. And if it's major, I can get into a hospital sooner. Whereas in South America, Ecuador and Peru, that's not always the case. So I saw patients come in who hadn't seen doctors for over a decade, who had been dealing with chronic illnesses that they haven't had the option to treat. And MedLife always talks about one specific story where there are multiple of these organizations that have this mobile clinic system that go down and help communities and provide healthcare and education and whatever they can to help. But there's a story about a young boy who came and had a broken arm. So one of these other organizations had the volunteers, the doctors come in, whatever it was, and put a cast on his arm. Very helpful, let it set, treat it the way that they could. And then 5 years later, they came back to the community and he still had a cast on his arm because there was no follow-up care. There was no option for him to have it removed. And it was just seeing the intent to help and helping in a sustainable manner that really aids the community is a completely different approach. So MedLife really focuses on that sustainable, proactive approach. So they have follow-up for all their communities. So there were patients who came in who had seen MedLife a year before or 6 months before and needed a prescription refill or needed new advice on whatever ailment they were facing, whatever it was, or they were familiar with the MedLife logo. And so they weren't terrified to come in and work with these volunteers. And seeing the hesitation in some people was very difficult. Seeing how scared people were to see a doctor, to see a dentist was very challenging to look at because the healthcare system to me has always been kind of a saving grace. It's just wonderful to have available. Whereas these individuals are terrified to even talk with a nurse about a headache they've had or whatever it is. But then you saw a family, you saw a mom come in with her 3 kids, doctor who had seen a nurse or a dentist or an OBGYN, whatever it was, and just was so grateful for the support. And you would see the community leader who worked with MedLife to facilitate the clinic in this area. And there was just so much hope and gratitude in their faces that it made everything we were doing feel worth it. It felt like we were having an impact instead of just intruding on these communities, which was really, really reassuring to see. And it was a big part of why I stayed on with MedLife, was to see the long-term impact that MedLife has had on these different communities all over South America and Africa as well.